In today's video, I'm going to be comparing working as a nurse in the UK in the hospital and working as a nurse in the care homes. A lot of overseas nurses, when they come to the UK or when they are planning to relocate to the UK, they want to know whether to choose working in care homes or working in the hospitals. So that's what I'm going to be describing in this video. So if you're interested, let's go. Hi, Linda Eze here. Welcome back to my channel. If you're new to this channel, welcome. My name is Linda Eze. I'm a registered nurse and I work in the UK. So I'm going to be talking about working in the care homes versus working in the hospital. So I'm going to be describing this in so many categories: work area, salary, culture, advancement, work progression, and everything. So be sure to stay to the end of this video because I'll do my due diligence and make sure that at the end of this video you will be able to know, yes, this is where I want to work, or this is where I don't want to work. Okay, so the first one is specialty or skill. Working in the hospital, you are allowed to work in different fields. Okay, so if you're an ICU nurse or a medical surgical nurse or an acute care nurse, and so many of those areas that we have in nursing, theater and the rest of it, you are more likely to work in all these areas if you are in the hospital. And this is actually an obvious one, isn't it? So but if you're working in a care home, you are more restricted in the sense that most times in the care home is usually people that are vulnerable, the elderly, and you are going to be working a lot with care assistants. You are still going to be working with nursing colleagues, but it's not going to be as vast as the hospital, in the sense that in the hospital you can decide to move from medical surgical ward to ICU to accident and emergency to acute assessment unit. In the care homes, you are restricted in the sense that you may be working in the same unit for a very, very long time. And again, about the skills is that you are also limited in the type of nursing activities you are going to be carrying out, because it is not an acute area. In this nursing home, you are more likely to be providing the basic care, like giving medication and making sure that the personal care and everything, the appointment, wound care, and some of those things. That's especially what you do in the nursing home. But in the hospital, you are more likely to do the advanced stuff like monitoring patients, acute patients. So what happens in the UK is that when a patient is stable enough, and cannot go home, usually most of these patients are transferred back to the care home, and then the nurses there now take it up from there. So some of those patients that have like long-term care, that take warfarin, all those long-term medication and the rest of it, the nurses there now take it upon themselves to make sure that the patient receive their medication, that they do their routine checks. So the take here is that in the hospital you perform the high skilled jobs that nurses normally do, while in the care home the skills are more restricted to the basic ones. Again, in the care homes, the type of patients you see are more stable. They are not as acute as the patients that you are going to be looking after in the hospitals. Okay, so in the care home, it's expected that when a patient really deteriorates, that you need to transfer to the hospital. When a patient becomes stable, the patient leaves the hospital. Another one, did you see one everybody wants to know, is about the pay. Okay, so how about the pay? The pay, obviously, if you check online, you discover that those in the nursing homes, usually they work longer, in the sense that in the hospitals, usually the contracted hours per week is usually 37.5 hours, while those in the care home, usually the contracted hours is up to 42 hours per week. And then the pay also in terms of hour is a lot more. So some people choose nursing home because their pay is higher, and then the kind of patient is not as acute as the hospital. Okay, but some people that actually want to hone their skills, the new nurses and people that actually want to move to other areas of nursing, then you discover that working in the hospital might be a better option. Whereas those that are actually focusing on making more money and everything, because sometimes the international nurses, you already have experience and have all those skills, some people go for the care homes. So in the care homes, they actually pay more, while in the hospitals, if it is a government hospital, you may be expecting to earn a lot less. Okay, but also note that some hospitals are also private hospitals, so this actually depends on whether it's a private hospital or NHS you're working. If it is NHS you're working, then it's most likely that you're going to earn a lot less. But if it's a private hospital, it might be almost the same salary you are earning in care home that you'll be earning in the hospital. So it actually depends. So but if I can just say generally, in the hospital and care homes, you are more likely to earn more in a care home than a hospital. Team that you are going to be working with if you're working in a care home. So in a care home, you expect to be working with more of care assistants, the physiotherapists, the dietitians, and occupational therapists, and you are going to be liaising with the communities, with the GPs that's in the community. So you are expected to, even though documentation is very, very important in nursing, in the nursing home, you are going to be very, very careful with your documentation. You make sure you document everything. There are method of assessments. You make sure that you pay attention to body mapping of patients, especially elderly patients. You make sure you assess them, their skin, and take note of any form of damage, any form of falls, any form of deterioration in the patient. So you are supposed to take adequate history of your patients. You are supposed to take adequate history of your patient, know when something goes wrong, when something changes, the nutritional history, their weight, all those nursing assessments. In the nursing home, it is very, very important. It is next level in the sense that you know everything, so that if the patient that was not really very confused becomes confused, it can be a sign of some form of infection. So you as a nurse, you are there making sure that you pick up some of those details. So working in a care home, sometimes people think, oh, it's very easy and I'm not supposed to do all those acute stuff, but it actually requires a very good skill. That's why nurses work there. So if you work there, you're able to pick up some of those things that ordinary someone that is not trained might not be able to pick up. So if there's a change in the patient's weight, if there's a breakdown in the skin, if the patient that is always very strong, that is always very independent, all of a sudden cannot actually be independent anymore, all those changes, you as a nurse is expected that you know all of those things. And then because sometimes you work more with healthcare assistants, it's most likely that if something goes wrong, they will always come to you, and the team is less in the sense that if it is in a hospital, you work with a lot of people are always present, while in the care home, some like the doctors and all those other people, pharmacists, the doctors and everything, in the care home they are not always present, so you have to make calls and everything. But if it is in the hospital, they are readily available. You can access the hospital, you can access the doctors, you can your colleagues, the nurses are there, so you can easily ask questions. If something goes wrong, it's not only you that maybe is looking after that patient. Like if something goes wrong at a particular spot, you have other nurses, other spectators, people that are there. So the nursing home, because most times you don't have the full team like you have in the hospital, that's why some people believe that maybe you are likely to get into more trouble, because then you are more in communication with the GPs and with more people, maybe the patient's relatives and everything. So it might be a little bit more complicated in the care home. Another one is career progression. Some people say that in the care home you are more likely to move from a normal nursing position to a managerial position very quickly. But then come to think of it, if you are interested in any other area of nursing, maybe you want to be a nurse tutor, or you want to go to work in the ICU or theater or accident and emergency, if you don't have experience in the acute area, you are going to be required to have an acute experience. That's where the hospital now beats the nursing home, because if you from nursing home and you want to work in ICU, it might not be very, very easy for you. Anything is actually very, very possible, but just these are some of the considerations. So I actually believe it depends on you. So if you want to work in a more acute environment, like if you want to be a nurse tutor, or you want to work in an ICU, or you want to develop your career in an acute area, then it's more likely that working in a hospital will be a better option for you, because now you have the necessary skills to teach, you have the necessary skills to move on to ITU. accident and emergency, acute and assessment unit, theater. So this is in the hospital. Those things are what you consider. So if you know what you want your career to look like in nursing, then you are more likely to make a decision whether working in a care home is better for you or working in the hospital. So what are my thoughts on this? I would say that it actually depends on you. It depends on what you want to achieve as a nurse coming to the UK. If you want more money, then you also already know the answer. But if you want the career progression, then you already know the answer. So what I think is that even though you make more money working in care homes, remember that even if you develop your career in a particular area, become a specialist in a particular area, you can also earn more in the future. So while you think about the short term, also think about the long term. I've seen a lot of people that don't want to progress, like to go up in the ladder in the nursing career, which is absolutely fine. Some people just want to work, make their money, and they will be happy. But if you want to progress in your nursing career, then think about the experience and the skills that you need. If you just want more money, then you already know what to do. So even in that care home, people still progress. In the hospital, only that you have more chances and more areas to choose from. In the care home, you can progress and you can decide to also do. Another thing you can do is that while you are working in a care home, you can also look for become an agency nurse and develop your clinical skills by going to the hospital. So while the nursing home is your main place, then you can also develop your clinical skills by working with an agency. Another one is that you can also choose the hospital, and while you're working permanently in the hospital, you also do your remaining 20 hours. If you're an international nurse, you do your remaining 20 hours in a care home. And you can also work with an agency while you are working in the hospital, and with that agency you can decide to choose and pick your shifts in a care home. So at the end of the day, it depends on you. So for the experience, for the growth, for the money, you can decide to combine working in a hospital and working in a care home. And then maybe the hospital can be your major place, and then the care home the additional one, or your main place will be the care home and then the additional one will be in a hospital. So I love the UK because it is very, very flexible. You can actually choose how you want to work. Okay, so while I would say, okay, why back home, why you want to say, oh, instead of taking so much time to decide where to work, I would say just pick one of them that comes your way, especially now that it is a little bit hard for the international nurses to get jobs, especially from restricted countries. Then I would say the available ones, take it. When you get to the UK and with your experience and everything, then you will decide the best place that you can work and grow from. Okay, so don't be bent on choosing and choosing and choosing. When you get one that is very good, most of these areas are very good. Once you do what you're supposed to do, you will always be fine. Money wise, when you continue to stay, you will discover how you can make amends. You discover how you pick your shifts that will be okay for you and for your family if you have family. Okay, so don't try to decide too much. Some people actually say care home is the best. Some others say, oh, NHS and the hospital is the best. So it actually depends on you. Anyone you choose. One thing I tell people is that when you eventually get a job and you get to the UK and you work for months and you still don't like it, instead of subjecting yourself to so much stress and unhappiness, it is better for you to change. I have colleagues that have changed from the hospital and even became nurse tutors, lecturers within their contract. Within those 3 years, within 2 years, people have moved from one hospital to the other. So thank you so much for watching. I appreciate you staying to the end of this video. Thank you for subscribing. Thank you for sharing this video and always coming back to watch my videos. I appreciate you all and I wish you the very best in everything that you do. See you in my next video. Bye.